Welcome to your Vitality Link briefing for August 2025. And this month, wow, we're not talking about some far-off future promise anymore. The AI revolution in healthcare, it's not coming, it's here. And it is completely changing the game.
So let's just cut right to the chase, to the single most mind-blowing statistic. There's a new AI model out there that is four times more accurate at diagnosing really tough medical cases than a team of experienced doctors. No, that's not a typo. It's a game changer.
And look, this isn't just a small step up. This isn't just a software update. What we're seeing right now in August 2025 is a true tipping point. This is the moment AI stops being just a handy little assistant and becomes an absolutely essential, you could even say superhuman, part of how we do medicine.
Okay, so how are we going to unpack all this? Here's the plan. We'll start with that tipping point, then dig into how AI is diagnosing the impossible, speeding up new cures, and how this whole revolution is actually scaling up. And then we'll talk about what this AI-powered future really looks like. All right, let's jump right in. Section 1, the tipping point. We're going to look at how AI is getting to superhuman accuracy, starting with that Microsoft AI that is just rewriting all the rules of diagnosis. Seriously, this is where it gets wild. Just look at this chart. The gap is, well, it's staggering. Microsoft's AI, it's called MAI, hit an 85.5% accuracy rate on some really tough cases. Now, compare that to experienced physicians. They came in at 20%. I mean, that's not just a little better. That's a whole different ballgame. So you're probably asking, how on earth is that even possible? Well, the secret sauce is this really cool method called a chain of debate. Think about it like this. Instead of just one AI trying to figure it all out, MAI-DxO creates a whole team of AIs. And they argue, they challenge each other, they debate. Basically, they act just like a real-world panel of doctors to find the best answer. And here's how that AI medical team actually works. First, one AI throws out a hypothesis. Then another one chimes in, figuring out the best tests to run. A third one crunches all the results. And then the magic happens. They all get together and debate until they reach a solid evidence-backed diagnosis. And get this, it's not just more accurate. This whole process also cuts diagnostic costs by around 20% because it's so good at avoiding tests you don't actually need.
And this isn't just about those complex internal cases. This is happening across the board. Take this quote from a UK researcher. They're using an AI to find these tiny hidden brain lesions that can cause epilepsy. Stuff that human radiologists were missing 64% of the time. The researcher said it's like finding one character on 5 pages of solid black text. It's literally seeing the invisible. Okay, so the diagnosis part is incredible, but what about the next step? What about actually curing things? Well, that brings us to our next section, accelerating cures and treatments, because it turns out the same kind of mind-blowing progress is happening there too.
And this isn't just one company doing this. The whole field is exploding. You've got Microsoft with its diagnostic AI, of course. But then there's Google with MedGemma, which is a huge deal. OpenAI's GPT-5 is making medical reasoning way safer. And Isomorphic Labs from DeepMind, well, they just hit a massive milestone. The key takeaway here is that AI is touching every single part of the process, from molecule to medicine. I mean, DeepMind's Isomorphic Labs now has AI-designed drugs, the first ever, going into human trials. That's huge. Then you've got giants like Amgen using OpenAI's GPT-5 for drug discovery because it makes 45% fewer factual mistakes. And AstraZeneca has an AI that can predict stuff like Alzheimer's years before symptoms show up. We are fundamentally shifting from reactive to preventative medicine. So this all sounds amazing in a lab, right? But the big question is any of this actually making it out into the real world? Is it helping real patients? Well, that's what we're talking about next, scaling the revolution. One of the biggest moves here is from Google. Their MedGemma model is now open source. And what that means is they've basically given a powerful top-tier medical AI away for free. Any hospital, any university, anywhere can now run this thing on a single computer, a single GPU, without these massive licensing fees.
It's the democratization of AI in healthcare, plain and simple.
And you know who's noticing? The market. This isn't just a science project anymore, this is big business. Just look at HeartFlow. They use AI to analyze cardiac scans, and they just had a massive IPO, raising $364 million. And that IPO, it led to a valuation of $2.2 billion. That is basically Wall Street giving a giant thumbs up and saying, yep, AI in medicine is for real. It's a valuable, commercially viable industry. But it's not just about the money. Behind that huge number is real human impact. HeartFlow's platform has already been used to help diagnose over 400,000 patients. We're talking 1,500 hospitals just in the US. Now that is what scaling up looks like. And AI is even getting into the nuts and bolts of making hospitals just run better. At Mass General, they have this AI called BusyBot. And all it does is predict how busy the radiology department is going to be the next day. But it does it with 83% accuracy. So they can staff up or down perfectly, which means shorter waits for you and less burnout for them.
So let's step back for a second. You put all of this together, the superhuman diagnosis, the super fast drug discovery, making these tools available to everyone, making hospitals run smoother. What does it all add up to? Let's talk about our new AI-powered future. Basically, this is the new normal in healthcare. AI isn't some fancy add-on anymore. It's becoming the core infrastructure. Diagnosis, AI is becoming the gold standard. Treatment, we're finding cures faster than ever. Accessibility, these amazing tools are getting into more hands. And efficiency, our hospitals are getting smarter. It's a total system upgrade. And all of this leaves us with one huge final question, right? If AI is getting this powerful, if it can diagnose better than a human, help create drugs faster, and even run the hospital schedule, what is the new role of the doctor? What does that partnership between human and machine look like going forward? That's the big conversation we all need to be having, starting right now.